Since 2018, the Galway Primary Care and Galway University Hospitals Occupational Therapy departments have collaborated and worked together on an innovative integrated project. This project delivers an occupational therapy-led specialised seating, assessment, provision and follow-up service. This service is for patients who have been admitted to Galway University Hospitals who are being discharged to a long-term care setting. These are patients who require specialised seating due to their complex functional and postural needs. Before this project existed, there was no identified funding stream for these patients. This meant that the service users or their families had to privately purchase this seating. This inevitably led to some delayed discharges or patients staying in the hospital setting longer than they needed to.
Since commencing the pilot project in 2018, approximately 150 service users have received an occupational therapy assessment under the long-term seating pathway. The good news is approximately 2,000 bed days were saved. There were no reported delayed discharges as a result of clients waiting for essential seating for discharge to long-term care setting. Patient length of stay was reduced significantly, and overall they received a very high quality integrated service from the Occupational Therapy department. So in order for a service user to receive intervention for the long-term seating pathway, they must meet the criteria as outlined in our programme. So once a service user is transferred into the long-term seating setting, the occupational therapist in the hospital then follow up with them in the nursing home setting and provide a reassessment, education for the staff and also regular reviews.
So whenever residents come into long-term care, first of all it's a very stressful, emotional time for them because accepting that they're coming into long-term care. The service that the OT provide is a continuity service from the hospital, an acute setting, into a nursing home setting. It enables the resident then to be independent as much as possible, to be able to go out, maintain relationships with families. Recently we had a man who had availed of the OT services from the hospital. He was able to attend his grandson's confirmation. It just wouldn't have happened. So that made a huge difference. Seeing photographs of the confirmation afterwards made it smiles, and it's just amazing. The OT services started coming in a few months ago and it has made a massive difference to residents' quality of life.
I assess the patient in the hospital for seating. I source the seating then from the primary care occupational therapy service, and then I ensure that I follow up with the patient when they are transferred to the nursing home. I maintain regular communication with the nursing homes and I build relationships with many of the clients that are in these nursing homes.
It made a huge difference. It made me more mobile, we'll say, as regards going places. Before Christmas now I went out to Galway twice. I know I have to go in the wheelchair taxi when I'm going, but still it gets you out to see what's out there now, because I spent 11 months in hospital without ever coming outside the door. And it was a hard thing to do, you know. You come back here now and it's just like home, like there's a real difference change altogether.
And without the service, it wouldn't be safe or smooth or consistent for the resident and for staff. And staff who are looking after these residents then know they're properly assessed, and it gives staff confidence in knowing that they're in the correct piece of equipment and that they're safe.
We're really proud to say that we have a truly integrated service between primary care in Galway and the Galway University Hospitals Occupational Therapy departments. We deliver a really high quality, safe, effective and cost-effective service, and has created a great solution for these patients.
For us it's such a rewarding I suppose time, because we got to strengthen our relationship working collaboratively together, and it was really I suppose exciting to see positive changes with service user.
We have learned a lot through delivering this project, and we will be happy to share and disseminate those findings with other occupational therapy managers throughout the country.
The risk is reduced enormously, and that's all we want for our residents, to ensure that they're safe in whatever equipment that they have, but especially for wheelchairs.
I would never have been able to come in here, only for them with the wheelchair and everything that they gave me. It's an enormous thing to me to have my life back a bit again.
Our overall aim for this project has always been to provide a high level, high quality integrated service under this long-term care vision of right care, right place, right time.